Hi, and welcome to Living In. Today we have a special guest, Dr. Katari from Capital Women's Care. Hello, how are you?
Good morning, thank you.
Good to have you on the show today.
Well, thanks for having me.
Yes, absolutely. So today we want to talk about women's health and how important it is in general for women's health to take care of yourself, but also how important it is during COVID. I know a lot of you out there are avoiding some of your chronic disease self-management appointments, but really let's talk about the safety of the office. So let's talk about that a little bit.
You know, I think Washington County, Maryland is in a particularly good place because by nature of the way we're spaced out and how we live in our homes and how much land we have and how much space we have and so forth, we're sort of almost naturally socially distanced to some degree. We just got to be careful not to get together in what they call super spreader events where lots of people get together in one place. And so you can imagine places like that would be things like movie theaters or packed restaurants and nightclubs and things like that. So they've been kind of closed or limited. Doctors' offices can be that way. I'm sure all of you have experienced doctors' offices where, you know, the waiting room is packed. And so I think that there's a lot of emphasis in doctors' offices about not only cleanliness, but also keeping people from being close or having packed waiting rooms. So in the beginning, we were decreasing the number of patients we're seeing per day to minimize the chance that lots of people would have to be close to each other. And over time, we've adapted. In my office, we have 25 exam rooms, so we can have 25 patients come in and register and go straight to an exam room where they're isolated by themselves until the provider comes to see them. And in the waiting room, every third or fourth chair is occupied and the rest are blocked off. So no one has to be within 6 feet of each other. We've had comments from patients that have been in our waiting room that they were there for 5 minutes and someone came down and wiped down things around them 3 times in that 5 minutes. And I said, "Ooh, I think we're doing a little bit too much." But you know, everyone's afraid and we want to project an image of safety for them. Because you know, not everything can be held off. There's lots of people that have to come because they're in pain or because they're having a really bad problem that just needs to be taken care of. And we want them to feel safe. So you have to wear a mask. You're sent a pre-screening questions to make sure we have people that have a cough or a sore throat or a fever. Make sure those folks aren't really coming to our office. And if they absolutely have to come, that we can isolate them. So I'm happy to report that we started these procedures in late March, and we are yet to have a single employee of our 93 employees have COVID that we know of, or a single provider. And you know, we're amongst the highest risk people because we're around patients all the time, you know, numerous people. And a lot of us have to be at the hospital where, you know, there are COVID positive patients. And despite that, our methods have worked because not a single employee of ours or provider of ours, doctors, midwives, or nurse practitioners and PAs have gotten COVID. And to our knowledge, none of our patients have either. And so, we've been really, you know, doing well with this. And I don't think that if you have a problem that needs to be taken care of, that you should feel that it's unsafe to come in. I really feel like we've done a good job. And I think that you should talk to others that have come and gone into a doctor's office and ask them, you know, did the procedures make you feel safe? And I would say that, to my knowledge, uniformly, all the offices in the hospital, the medical system have done a good job.
Absolutely. And I can speak for Dr. Katari's office. You know, hand gel is prevalent throughout the building, and so they have the resources to help you. If you need those resources to be able to come, you can just pick up the phone and call the physician's office and talk to them about that. But let's talk a little bit about women's health. Okay. So as people age, what are some important things that they need to keep at the top of mind awareness so that they are staying healthy and improving their quality of life?
You know, I think that I can go into that conversation for days. But the reality of it is, you know, there's a correlation between weight and life expectancy. And especially as we get older, as I get older, I worry, how much longer do I have to live? I want to live. Life is good. And I want to live, and I want a good quality of life as well. And we sometimes focus way too late on our weight. But we do know that the higher your body mass index in general, the less long you live. And so I think that exercising, eating right is something it's easy to say and hard to do, but it's really of paramount importance. So that's the first thing I'll say. You know, we talk about the things that are most likely to take your life. Heart disease being number one. Currently, you know, certainly it's correlated with weight. Diabetes, high blood pressure, heart disease, strokes, all of that is correlated to weight. But after all of those things, you know, cancer is pretty high on the list. And some cancers you can't do anything about, you know, pancreatic cancer, sometimes some brain cancers, there's no screening test for them. But there are many, many cancers. The most common ones that there are screening tests for. There's mammograms for breast cancer, which is top of mind for women. There's colonoscopies and Cologuard and several other colon cancer screening techniques. And by the way, when you're screening for cancer, it's 100% covered by almost every insurance. So it doesn't cost you anything. You just have to go in and get it done. So I think cancer screening, mammograms, pap smears for women, colonoscopies, and then osteoporosis is the other condition. Now, osteoporosis is one of those conditions that is near and dear to my heart because my mom suffered greatly from osteoporosis in her latter years, and it took away her quality of life. I always tell people osteoporosis won't kill you, but it'll take away the joy of life. And I think a lot of people don't undergo osteoporosis treatment for many reasons. And one of them is simply you don't want to necessarily screen for something that's not cancer and that isn't affecting you now. If you feel fine now, why am I getting this test and why am I potentially going on a medication or altering my life? I feel fine now. And osteoporosis is one of those things that you feel fine until the day that it affects you, and then you just never feel well again. And so, and osteoporosis tends to be something that is everyone, in the physician world, it's everyone's responsibility, but no one's responsibility. When you think about a gynecologist, they're there to do your pap smear and do your breast exam and do your mammogram. You think about primary care, they're supposed to check your cholesterol and your blood pressure and so forth. But osteoporosis screening is something that everyone's allowed to order and should order, but no one seems to feel like it's their thing. And so Capital Women's Care, we have a central bone density machine, and we take osteoporosis seriously. We screen right in the office along with annual checkups and visits. And so we think it's important. Again, I think I've always felt that way because of how it affected my mother when I was younger. So I think that I often say, number one, Medicare covers osteoporosis screening and almost all the treatments. So does every other insurance because it is a serious condition, and everyone in the health profession knows it. So that's something I wanted to really emphasize in the few minutes that I have talking to you guys today.
Absolutely. And it's really important, whether you're in poverty or have Medicare or Medicaid, is to reach out to the physician's offices like Capital Women's Care, and they'll be happy to discuss that with you. So if you have questions about coverage and what's covered and the insurances that you have, you can talk about that before you even go to the appointment, so you have peace of mind and knowing that that's covered and that's not a burden. And also the safety that we talked about at the beginning of making sure that your physician's office is participating in that COVID cleaning of high touch areas and that they're wearing masks and that hand sanitizer is available. Those are definitely common practices that we're seeing across the board at physicians' offices all over. But really it comes down to maintaining your quality of life and taking care of yourself. Because we can order all of these wonderful tests and pre-screenings and talk about that, but really the decision is up to you and how you want to live out those years and those golden years as they refer to it. But taking care of yourself, and that's healthy eating and exercising, and you can get some of those educations right here at the Commission on Aging by visiting our Facebook page so that you can participate right while you're at home in those exercise programs. And so some of the weight building exercises to increase bone density and all of those things, and a good healthy diet is important. So just because you're living in doesn't mean that you're stagnant or that you're forgetting about all of these wonderful appointments and things that you should be doing to improve your quality of life. So Dr. Katari, is there anything else you'd like to add?
I just want to add one last thing, and that is that for those of you that really have a difficult time coming in or really are afraid of going out because you feel like you're vulnerable for health purposes, there are many things we can do with telemedicine these days. Absolutely. Our office offers virtual visits, as does all of the emeritus practices, and I would think most practices do at this point. You simply call the office and say, hey, I don't want to come in, but can I do a virtual visit with my doctor? There's a lot of counseling that can happen. Tests can be ordered that way. So for example, hey, I'm worried about my bones. I'd love to do a bone density, but I don't want to come in to talk to you about that. We can order that and schedule that. Of course, you'd have to come in for the test, but you don't have to come in for every visit. If you said, hey, I have a pain somewhere, exams are probably needed for that kind of thing. But a lot of times it's about advice. I'm having this concern or I'm having that concern. We do an awful lot of visits, even for urinary tract infections, for example, virtually now. And it's because we, in the end, want to take care of you and don't want to endanger your health. And so, yeah, telemedicine is something we use much more often than we used to. And it's simple as having your smartphone. Most of us have an Android or Apple phone or an iPad. All of that can be used, and platforms are very simple. So don't hesitate to think about that if you really can't come in or don't want to come in. Oftentimes we can address your issues with that.
Absolutely. And it's really about taking care of yourself. So don't put it off. So if there's something going on, you mentioned urinary tract infections, that could be a whole nother segment that we invite Dr. Katari back to talk about. But really important, especially as you age, and hydration is super important as well. So make sure you're drinking enough water and staying hydrated. But thank you, Dr. Katari, for joining us. We'd love to have you back for a few more segments of
Thank you
Women's
for having
Health.
me. I look forward to it.
Absolutely. And thank you so much for joining us for Living In. Until next time, continue to wear your mask and stay safe, clean high touch areas, and keep your hands cleaned.